While most cancers depend on environmental factors such as diet or tobacco, they can be genetic as well, passed on from generation to generation. One way to determine if you could be affected is to have genetic counseling. Joining me now are Emily Kaczynski, a certified genetic counselor with the MedStar Health Cancer Network, and Lori Eastridge, a patient. Welcome, both of you.
Thanks for having us.
Glad you're here. So tell us first and foremost, what is genetic counseling?
So genetic counseling is working with patients and families who may have an early diagnosis of cancer, so at a young age, before 50, or have multiple family members with the same or related cancers, and they learn, the chances that cancer could be inherited. And we offer these high-risk families genetic testing, which is just a blood test, and will determine if the cancer is inherited.
And I know that you went through this process, Lori, correct?
Yes, I did.
And what prompted you to do this, and at what age did you do it?
I did it at the age of, last year? Was it last year?
Mm-hmm.
So 39.
Okay.
And my mother had cancer, and my grandmother had cancer, and my aunt had cancer. So my mother had the genetic testing done, and she had a gene, and she encouraged me to do it too, and I have the gene also.
Okay. And so what do you do when you find out that information? Was it an empowering step for you to find this information?
It was an emotional, to find out.
Yes.
Because then I had to make decisions on, for my future. I also have a daughter, so I had to worry about her future. And I went through trying to think about what decisions I needed to make.
And as you're going through this process, I relate to that, and having a daughter, and you think you want to do the best for your family.
Yeah.
You talk to a lot of patients like Lori. What are the next steps that happen when you find out that you might have a gene that is in your family for this?
Yeah, there's actually quite a few next steps. So the greatest way to reduce your risk for breast cancer is to have your breast removed. But that's not the right next step for all patients. So there also are increased screening options. So we can start breast mammograms at 25 to 30, and we can also add in a breast MRI, which gives us better sensitivity for breast cancer at a young age too.
I think it's amazing that you did this both for your daughter, for yourself, and also for your family, that they can know and get this information. So what would you say to someone that maybe is in the same situation where they're looking at their family and they're thinking that maybe there's a chance, should I or should I not get this genetic testing? What would you say to them?
I would try to encourage them to get it done, because there is options out there. There is a lot of support. Emily gives me a lot of support, and also there's studies out there that like she said, gives more monitoring, and which I do too. I go every 3 months and get monitored, and it makes me feel safer and feel better that I'm keeping a close eye on myself, as of also other people keeping a close eye on me also.
And I think that's what it is all about, is sort of taking your health in your hands as much as humanly possible,
Yes.
and doing that in a community, which you do with MedStar. So thank you so much for being here. If you have any questions, there is WMAR2's news house calls that's happening today from 4:30 to 6:30. Just call that number, 410-481-2222. You can ask your questions to Emily and Dr. Kristen Fernandez. Again, that's starting today at 4:30 p.m. We'll be right back with more Midday Maryland right after this. Stay tuned.